Hi everyone, this is Sean with the MassSupport Network, here with your COVID-19 update for Friday, October 16th, 2020. So, starting with the case counts across the world and here at home. Worldwide, we saw an additional 2.3 million new cases in the last week. That is an increase of another 100,000 additional cases over the increase from last week, which also was an additional 100,000. So we are steadily increasing worldwide. Here in the US, we are also seeing an increase in the rate with 380,000 new cases in the last week, which is about 50,000 more than the increase last week. Here in Massachusetts, it was about 4.6 thousand new cases in the last week, which is about 500 more than we saw the week before. So across the board, things are trending up. In terms of deaths, things are mostly holding steady, if not declining slightly. About 35,000 deaths worldwide, 5,000 of those here in the US, and 87 in Massachusetts, which are all more or less holding steady, if not slightly lower. But when we look at the country as a whole, deaths are the only thing that's trending down or holding flat right now. Testing, fortunately, is still trending upwards. We are several times in the last couple of days, we've gotten over 1 million tests conducted in a single day. However, case counts are also rising similarly, and we are back to where we were at the beginning of August. We're at the same level, if not higher, than where we were during that last plateau after we came down from the July surges. You can also see hospitalizations creeping back up as well, and we'll look at that more on the next slide. So here's the hospitalizations over the entire course of the pandemic. The initial wave with the northeastern outbreaks in April, then the July outbreaks in the south and west, and the two low points there on September 20th and June 20th, when we hit our lowest point with just under 30,000 people in hospitals across the country. And now we've started to rise again. So now we're kind of at a point where we were kind of early July in terms of the second surge there. The curve does appear to be a little bit flatter than it was before, which is hopeful, but we should expect to see this rise as case counts continue to go up. Because case counts and hospitalizations tend to go hand in hand, as you can see here. The red line here is the 7-day averages of new cases, whereas the yellow line, the blue line is the hospitalizations, and they tend to follow pretty soon after, especially indicative in that second peak there, where you can see the hospitalizations are just a couple of days behind the new cases. So we should expect to see those going up soon. So in terms of developments, that's kind of the big one right there, is that many people are now calling this the second wave, or often the third surge, because we can never really say the first wave actually stopped on the country as a whole. In the Northeast, we're certainly looking at the second wave starting here. But when we look at those case counts around the country, it's we've never dropped low enough to make this a new wave. This is so third surge is the term that's being thrown around a lot in the last couple of days. Europe, however, is definitely on its second wave. France, the Netherlands, Belgium, Spain, England are all seeing case counts that rival or pass their spring numbers. So that is signs that we should expect pretty much everywhere that isn't currently in a surge to be in one soon. So when it comes to treatments, first of all, 2 trials are currently on pause right now. Johnson & Johnson has paused its vaccine trial, and Eli Lilly has paused its antibody trial. So both are due to potential adverse effects in participants. whereas someone in the trials had some negative health outcome, and so the trials are on pause to determine if it was related to the vaccine or antibody treatment or not. And just remember that pauses like this are actually good because it means that they are running the trials correctly. They are following up for any potential side effects. Of course, any serious side effects in any of these treatments are very important to know before we start distributing these on a massive scale. Continuing on the topic of treatments, Pfizer has stated that it will not seek approval for its vaccine until late November. Pfizer was the one vaccine company that was still sort of hinting that it might be able to put its product out there before, or at least get approval for its vaccine project before Election Day. However, it's now saying that it will not seek approval till late November, so no vaccine producer is now committing to have anything out in the next 3 weeks. Moderna and AstraZeneca have both said it would be more towards the end of the year, and no one else is anywhere near close enough. And finally, and unfortunately, herd immunity is again in the news. There was 3 scientists brought together by a libertarian think tank called the American Institute of Economic Research, based in Great Barrington, Massachusetts. And these scientists put together a plan which is now being called the, quote, Great Barrington Declaration, which is a plan that calls for shielding the most vulnerable people in the population, elderly and people with underlying conditions, and having everyone else go about their lives, restore the economy, and get back to work with absolutely zero mention of masks, the plan being to allow the virus to run through the healthy population until herd immunity is reached. The public health community responded very sharply to this plan, pointing out how it will kill thousands of people, would not work, and that even if it did, we would have a vaccine long before it could be effective. I was hoping not to have to cover it at all, and this would just die away, but it has started to gain some traction in certain political circles, so here we are. Dr. Anthony Fauci has called this plan nonsense, and several thousand other scientists have signed a counter-declaration called the John Snow Memorandum, which is of course named after the epidemiologist who fought cholera in the 1800s and not after the Game of Thrones character. But this is a current battle being waged in science and public health right now. The vast majority of scientists and experts are firmly on the John Snow memo side, not the Great Barrington Declaration, and are instead advocating for our traditional public health measures of targeted lockdowns when necessary, masking in public areas, contact tracing, as opposed to trying to shoot for herd immunity, which again is, even with the plan suggested by the Great Barrington Declaration, is very difficult because we require a massive amount of people to become infected, and the amount of people necessary to the vulnerable population they refer to being protected is hundreds of thousands of people, millions of people really, which is A, going to be incredibly difficult logistically to do, and B, many of them it wouldn't work for, and many of those millions of people would die. So there's not, which is also not speaking about additional people who die due to lack of hospital resources if hospitalizations massively increase as a result of uncontrolled spread. So there's that. So for today's stats and trends, you can always go to the COVID tracking project to use the New York Times trackers for the raw numbers for the world and country, and mass.gov has the Massachusetts info. And for more on the last topic of today's development, there's a link to the Great Barrington Declaration and the John Snow Memorandum, so you can look at both of those for yourself. You can also, I thought it was fun to put on there, put the town of Great Barrington's own response to the Great Barrington Declaration, which I found to be interesting, and you can see that for yourself if you want to. For more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.